Hello there, my name is Nathan with Meta65.com. Today we're going to talk about the differences between Medicare Advantage and Medicare Supplement plans, also known as Medigap plans. So basically, if you're new to Medicare, or even if you've been around for a while and you just pick the first thing, we're going to just talk about the differences between Medicare Advantage or Medicare Supplement plans, otherwise known as Medigap plans.
Before we move any further, if you're considering Medicare Advantage plan to save money, consider this. We usually help folks on a fixed income. With a Medicare Advantage plan, there could be surprises, big surprises. Let's look into what I'm talking about here. We want to avoid the red line as much as possible. With Medicare supplements, the majority of your healthcare expenses are paid. If you have a Plan F, for example, 100%, Medicare will pay 80% of your Part B expenses, and your Medicare supplement plan will pick up the additional 20%. So there's no surprises. Now, if you have a Plan G, there is the Part B deductible, but that's all you have in a year. So it's possible to keep your healthcare expenses level with a Medicare supplement plan as opposed to a Medicare Advantage plan with the co-pays, co-insurance, and all the different things. Your healthcare expenses can go up. So let's just kind of look at a chart here. As far as Medicare supplement plans, there is no network. There's no doctors. I had a gentleman one time want to go and check and see. He was looking at a Medicare supplement plan, and he wanted to see if his doctor took it. Yes, the answer is yes. Your doctor will take a Medicare supplement plan, any Medicare supplement plan, as long as the doctor takes Medicare and as long as it's an approved Part A or Part B expense. With a Medicare Advantage, there is restrictive networks. You have to stay in their networks. With a Medicare supplement plan, there is no co-payments to providers. With a Medicare Advantage plan, there is. Your cost, most Medicare Advantage plans have a $6,700 annual out-of-pocket maximum. And what that means is it doesn't mean you're going to spend $6,700 a year, but you could, should the catastrophic happen, you may spend up to $6,700. With a Medicare supplement plan, that's a big no because everything is covered under a Medicare supplement plan. The health plan decides which tests and procedures are approved for you. In a Medicare Advantage plan, that's a yes. In a Medicare supplement, no, there is no approval needed. Anything that is Part A and B is covered with the supplement, or it fills in the gap, otherwise known as Medigap. Can you be canceled with a Medicare Advantage plan? You can be canceled, and plans drop. I've seen this happen before where the plan actually drops. With a Medicare supplement plan, there's only one reason you can be canceled, and that is if you don't pay your premiums. Ability to travel to the country and ability to travel throughout the country and use any doctor. With Medicare Advantage, that's a no because you have to stay in their network. With a Medicare supplement, you can travel anywhere in the United States and see any doctor that takes Medicare. Any of the 50 states. Is pre-certification required for some treatments? No on Medicare supplement, yes on Medicare Advantage. Cancer centers and Mayo clinics. This is a big thing. Some folks travel to the Mayo Clinic in Minnesota, or there is other cancer centers with a Medicare supplement plan is a yes. With Medicare Advantage, you have to stay in their network. So no, you cannot travel to different facilities. You have to stay within the network. So just some things to consider on your Medicare Advantage versus your Medicare Supplement plan.
You basically got two different roads to go down. You can go on this hand, you can go Medicare Advantage or Part C of Medicare, or you can go down the other path and stay with original Medicare and supplement, fill in the holes that Medicare doesn't pay. And that's why it's sometimes referred to as Medigap, because it fills in the gaps and pays what Medicare does not pay. So first, let's talk about Medicare Advantage. So I've typed in here into Google, define Medicare Advantage. Basically, Medicare Advantage is a private company that's been approved by Medicare, and Medicare pays these companies to take care of your Medicare benefits for you. So they have to offer at least what Part A and Part B do. Some folks might ask, so what is the advantage to a Medicare Advantage plan? So the number one thing is the premiums are very low. In some cases, you can even have zero premiums. So I've seen $40 a month. I've seen zero. I've seen 10. I've seen Medicare Advantages as high as $214. But generally, the premiums are very low. Medicare Advantage are a HMO plan usually, or a PPO plan, and they work much like a traditional health plan that you may have had with your group work benefits. So Medicare Advantage plans are very similar in that regard. So that would be, as we said, the advantage would be low premiums. And some other advantages that a Medicare Advantage plan has is a lot of times they will throw in some vision and dental and hearing. It is very important to note, though, that these are not a full comprehensive dental, vision, or hearing. It's just a little bit of preventative care that are thrown into most of these Medicare Advantage plans. They also, another advantage is many of them have a gym membership thrown into them. So let's talk about some of the disadvantages to a Medicare Advantage plan. The disadvantages are they have copays. When you go to the doctor, you're going to pay, they're typically $10 to $15. Go to the emergency room, it's typically $75. They're going to have a big book that's going to show you whatever you do is going to cost something. So I've heard seniors tell me before that this plan is nickeling and diming me to death with all these different charges. They're great for when you're healthy and never use them, but if you start using them, the charges can really add up. In fact, most of them, especially the ones that have the lower premiums or the no premiums, have for 2016, there was a max out-of-pocket of $6,700. You heard me right, $6,700. Now, that doesn't mean you're going to pay that every year. That just means the worst thing happens. You have a lot of surgeries. You go to the doctor quite a bit. Your max is $6,700 for calendar year. Now, some of the ones that have premiums have different, out-of-pocket maxes. Like I've seen $2,000 and $3,000, but you have to pay for them. Okay, so that is a disadvantage to Medicare Advantage, is the max out-of-pocket. Now let's talk about Medicare supplement plans. So we're going to go here to the Medicare guidebook here that's put out by CMS every year. And this happens to be the 2017. I'm going to go to page 81. Section 6. As you can see, Medicare policies are standardized. So basically, that just means that, from one company to the other, CMS sets the standard, and the insurance company, whether it's insurance company A or B, you're not going to have a different benefit. And you're not going to have a network. That's something that I should have mentioned with Medicare Advantage. With Medicare Advantage, there's networks. You have to have a primary care physician in Medicare Advantage. You have to stay within a geographical region with Medicare Advantage. You have to stay in their networks. If you're an HMO plan, usually you have to get a referral to see who you want to. Not the case with Medicare supplements. Medicare supplement plans, you go to any doctor or hospital in the entire 50 states of the United States. As long as they take original Medicare, they will take your Medigap plan or your Medicare supplement plan regardless of what company you're with. So they're basically categorized by letters. Now, I'll have a separate video comparing, we're going to probably compare Plan F and Plan G. But let's just take a look here at Plan F. Plan F is what you'll hear sometimes referred to as the Cadillac plan. It's the best. And the reason why it's the best is it covers 100% of everything Part A and B do not cover. So essentially, outside, now your drugs are a separate issue, but outside of drug coverage, as long as you pay your Medigap premiums, you're going to not have to pay anything else for Part A and Part B expenses. You go to the doctor, you get a Plan F, you pay nothing. You go to the hospital, you pay nothing. There's no deductibles, no co-pays, no co-insurance, and it's law. Everybody in America, every doctor in America, as long as they take original Medicare, they have to take your Medicare supplement plan. Now, that is with Plan F. Some of the plans now, obviously, Plan F is the most expensive, and we'll talk about more of the different premiums for those. And then Plan G would be the next one down. As you can see from the screen here, it does not cover the Part B deductible. So Plan G will have, and for 2016, the plan or the Part B rather deductible was $166. For 2017, it'll be $183. But a lot of times that is a good value. So a lot of folks do look at a Plan G because they only have the small deductible to pay. And then you can go on down Plan N's, Plan D's. Some insurance companies don't even carry the different letters. They just have to follow the standards that are set forth by Center for Medicare and Medicaid Services, or otherwise known as CMS. I hope you've enjoyed today's video about the differences between Medicare Advantage plans and Medicare Supplement plans. If you have any further questions, give us a call at 1-888-245-1311. Have a great day. Like what you see today, subscribe to our YouTube channel or like us on Facebook at facebook.com/SaveOnMedicare, or give us a call at 1-888-245-1311. I look forward to hearing from you.